At CarePatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. A headache chart, sometimes referred to as a headache diary, map, or log, is an essential tool for tracking patterns, triggers, and symptoms associated with headaches. It's particularly useful for individuals who suffer from recurring headaches, as well as healthcare providers working to understand the frequency, duration, and intensity of these headaches. By keeping a detailed record, patients can actively engage in their care, making it easier to identify potential triggers, track headache severity, and assess the effectiveness of treatments or medications. Let's break down how to use a headache chart effectively. Firstly, fill out the initial information. Start by noting the key details whenever a headache occurs, things like the date, time, duration, pain intensity, type and location of pain, and possible triggers. It's also crucial to record any symptoms such as nausea or sensitivity to light and any treatments or medications tried, along with how effective they were. Review and analyze. After gathering enough data, review the chart to spot patterns. Healthcare providers can use this information to diagnose the type of headache and formulate a treatment plan. It's also helpful to interview the patient for additional details like their mood or any significant events around the time of the headache. Store and update regularly. Even after a treatment plan is in place, it's important to keep updating the headache chart. This ongoing record helps healthcare providers assess the effectiveness of the intervention and make adjustments as needed. Now let's briefly explore some common types of headaches that patients may experience. Tension headaches. Tension headaches are the most common type, often described as a dull pressure-like pain that feels like a tight band across the head. They can be triggered by stress, poor posture, or muscle tension. Migraines. Migraines are more severe and usually involve throbbing pain on one side of the head. They often come with nausea, vomiting, and sensitivity to light or sound, and can be triggered by things like hormonal changes or certain foods. Cluster headaches. These are rare but extremely painful, occurring in cyclical patterns. They cause intense pain around one eye or temple, and are often accompanied by tearing, nasal congestion, or facial flushing. Sinus headaches. This results from inflammation or congestion in the sinus cavities. They're usually felt around the eyes, cheeks, and forehead, often linked to sinus infections or allergies. Medication overuse headaches, also known as rebound headaches, occur when pain relief medications are used too frequently, leading to chronic headaches. Secondary headaches. These are caused by underlying medical conditions like head trauma, brain tumors, or infections. These require immediate medical attention. Thunderclap headaches. These are sudden, severe headaches often described as the worst of someone's life. They can indicate a serious condition like a brain hemorrhage and require urgent medical evaluation. Lastly, occipital neuralgia and cervicogenic headaches stem from issues in the neck region. Occipital neuralgia involves sharp electric shock-like pain originating from the base of the skull, while cervicogenic headaches are often caused by neck disorders and may include stiffness or tenderness in the neck muscles. In summary, a headache chart is a powerful tool for both patient and healthcare providers, offering valuable insights into the types, triggers, and severity of headaches. If you'd like to see a sample of our headache charts, check out the example we've provided. And to explore more templates or learn how CarePatron can simplify your practice management, visit our website and sign up for free. If this video is helpful, don't forget to like, subscribe, and check out more of our content.